Hi, I'm Vikas Patel, orthopedic surgeon here at the Orthopedic Institute of North Texas, and today I'm going to talk to you about the difference between anatomic and reverse shoulder arthroplasty. To start, the shoulder joint is a ball and socket joint with the ball coming from the humerus or your arm bone, and your socket called the glenoid, which arises from your shoulder blade. Arthritis can occur in this joint and can be very debilitating and can lead to loss of function and a poor quality of life. While there are lots of non-surgical options available, sometimes a shoulder replacement is needed. The two types of shoulder replacements are either an anatomic shoulder replacement or a reverse shoulder replacement. The anatomic shoulder replacement is where the ball and socket are removed and replaced with metal and plastic. The old arthritic ball is replaced with a new smooth metal ball, and the socket is replaced with the plastic component. A reverse shoulder replacement is where the parts are switched. Your old arthritic ball is replaced with a metal and plastic socket, and the socket is replaced with a new metal smooth ball. So, why would you do one over the other? This all depends on your rotator cuff. If your rotator cuff is healthy, you can either have an anatomic or a reverse shoulder replacement. If you have a full thickness tear of your rotator cuff and an anatomic shoulder is placed, there's a high chance of failure and need for another surgery. In this situation, your only option is a reverse shoulder replacement. The amazing design of the reverse shoulder replacement allows your deltoid to take over function for your rotator cuff to allow for motion in your shoulder. When evaluating the outcomes between these two options, functionally, there is no difference. While all the studies have shown that both options are great at reducing pain, improving function, and improving the quality of life, there is no difference in terms of range of motion. The main difference, though, comes to how your shoulder feels. While the shoulder replacement will never feel like how it did 30 years ago, the anatomic shoulder replacement feels more natural because the parts are in the same place as you were born. The reverse shoulder replacement, because the parts are switched, your shoulder mechanics are a little bit different, and that's really the only difference that patients will notice afterward. Overall, either an anatomic or reverse shoulder replacement are great options to decrease your pain and improve function in the setting of shoulder arthritis. If you have shoulder arthritis or are concerned that you may have arthritis, please call the Orthopedic Institute of North Texas today, where we can be able to generate an individual strategy dedicated to you. Thank you.